Hello, this is a quick explanation about the sonographic long axis images of the IVC and the aorta, which are on the images to label, and I'll just go through those for you. So this is one of the images to label, which is showing a long axis image of the IVC. And I've drawn a head and some feet here to help you orientate towards the head and towards the feet orientation. We can tell it's the IVC because the walls of the IVC are not parallel. They're sort of variable. The IVC is variable in its thickness. The IVC is traveling up here towards this structure where it's going to pierce this structure. So this structure is actually the diaphragm. We're not seeing the caval hiatus very well. This here anterior to it is the liver and more the left lobe of the liver. So number 2 I would call left lobe of the liver. Number 3 is referring to a vascular structure and probably the left hepatic vein. We can tell the difference between hepatic veins and portal veins because hepatic veins are more vein-like than a portal vein because they're draining blood away from the liver, and so it doesn't have bright or echogenic walls. We've probably got a bit of the caudate lobe sitting just in here, and then this bit here is the left lobe of the liver, and then these calipers are placed on the thickness or the depth of the IVC. So number 4 is the IVC, and your answer should be inferior vena cava, not IVC. So I hope that explains what we're seeing. At the back, we're not seeing the spine because the spine will sit a little bit more to the medial or over the more. The IVC sits to the right side of the patient from the spine. This was an image that we talked about in the lectures, and this is just another image of the IVC. You can see it's variable in thickness. This here is the left lobe of the liver. This is the caudate lobe. This little thing here is our ligamentum venosum. And this here, for those of you with keen eyes, is actually the pancreas. On this image here, we've probably got the left portal vein, the left branch of the portal vein, and it's got more echogenic walls. This is the diaphragm here. This is actually the caval hiatus. We're seeing a little bit of the heart just here. Here we can see some abdominal wall muscles. The caval hiatus, remember it's this area here, and remember blood is traveling back from the body up through the IVC and into the right atrium of the heart. So our probe would be placed here, and you can see that the spine sits a little bit more over to the midline, and the IVC sits more to the right side of the patient. This patient's a little bit oblique just here as well. So here you can see the IVC, which also sits a little bit as it pierces that diaphragm, a little bit more anterior to where the aorta will sit. The next image that I'm going to go through, and this was on the images to label, is the long axis sonographic image of the aorta. So we've got superior here, and this is towards the feet, so always think of your patient lying down with their head here. They're supine, so this is anterior and this is posterior, and here's their little feet down here. So why do I know that this is the long axis image of the aorta? Well, firstly, there's a vessel along here, and it's got fairly parallel borders. The outer margins of the aorta are also more echogenic. If you look at the IVC, the borders aren't as echogenic as they are of the aorta. So you can see it's, and then it's also got all these anterior branches because this is anterior and this is posterior. So then we have to orientate ourselves. So we go, oh, this is towards the head, and there's a line running along here. So number 1 is probably indicating our diaphragm. The aorta is going to pierce it. We've got a bit of a artifact here, so it looks like it's not going through this aortic hiatus of the diaphragm, but it is. It's just a sonographic artifact. So then we think, oh, well, this thing sitting anterior to the aorta must be liver. So we're going to call this liver. This structure here is what we're going to call abdominal aorta. And then what does the abdominal aorta sit in front of? We just go back to this image. Here's the abdominal aorta, and what sits immediately behind that? Vertebrae and intervertebral disc. That's exactly what we're seeing here, a vertebral body and an intervertebral disc. An intervertebral disc and a vertebral body. And that's what these structures are. And then we're going to see, as I said, the aorta, and then we go, oh, here's an anterior branch, here's another anterior branch, and they're sort of the first ones that come off anteriorly in the abdominal aorta. So this will be our celiac axis or celiac trunk. Both those names are correct. And this is going to be our SMA, which stands for superior mesenteric artery. So that's what this structure is, celiac trunk, SMA, abdominal aorta. We've called this liver, we've called this diaphragm. What is this thing that's sitting anterior to the aorta, up near the diaphragm, it's more closer to the head? We know the crus of the diaphragm sit in there, but that looks a bit bigger than the crus. Let's go back to this image here, right up near the diaphragm. We had our caval hiatus. Oh, the hiatus for our esophagus. So that would happen here, and there's a little break in the diaphragm. So this is going to be our gastroesophageal junction. So this is where we're really using our three-dimensional anatomy, and that number 2 is quite a difficult structure for you to label, and you really needed to think about that. So if you struggled with it, that's very normal. Don't worry. So this is our gastroesophageal junction. This could be a little bit of our crus of our diaphragm just here. Now 2, 3, and 4, don't worry, just call them both liver at this stage. We could say that number 3 has more echogenic margins around it, and it could be a branch of the portal vein, as opposed to a hepatic vein branch, because we wouldn't see the echogenic walls. But at this stage, I really just want you to identify that this is liver. There you can see our gastroesophageal, well, our hiatus for our esophagus, and then it quickly joins our stomach. So gastro means stomach, and a junction is where something joins one another. So this is just indicating that we're going to see our esophagus and then join immediately to our stomach down here. Here you can see the celiac trunk and then the SMA, which arise just immediately inferior to the crus of the diaphragm. So here we had our gastroesophageal junction and our crus, and then we could see our celiac axis or celiac trunk and our SMA. We talked about this in the tutorial, and also said, remember that the blood is going down towards the feet. So if we go back this way, the blood is going towards the feet because it's come out of the left ventricle. It's gone through the ascending aorta, over the arch, then down through the descending thoracic aorta, and then it comes into the abdomen, and it goes down this way in our abdominal aorta, and our spine will be back here. Our aorta is going to sit more anterior to our spine, and our IVC will sit more to the patient's right. I think that's it. I hope that helped unpack some of those long axis sonographic views of the IVC, the inferior vena cava, and the abdominal aorta. Thanks. Bye.